Introduction to Epidemiology, Week 3 assignment. Population Attributable Risk video presentation. Tuberculosis by Alexander Humphrey. Tuberculosis is an infectious disease that is caused by a bacterium called Mycobacterium tuberculosis. Although this bacteria attacks the lungs, it can attack any part of the body, such as the kidney, spine, and the brain. There are TB-related conditions that exist. For example, latent TB infection known as LTBI and tuberculosis TB disease. Tuberculosis can be fatal. A person can be infected with latent TB. This type of TB lives in the body without making you sick. Many of those who develop latent TB never actually develop the TB disease. Their body can fight off the bacteria. Both those with a weakened immune system, the bacteria becomes active and multiplies, causing the TB disease. A positive untreated patient sputum can infect roughly 10 people per year. What causes tuberculosis? Tuberculosis is a disease that is spread through microscopic droplets from person to person when they cough, sneeze, spits, speaks, and even laughs. You can be at risk for TB if you have spent time with someone who has TB, if you have traveled to countries where tuberculosis is common, such as Africa, Asia, Eastern Europe, Russia, Latin America, and the Caribbean. If you live or work in areas that are known as high risk, such as long-term care facilities, nursing homes, correctional facilities, and homeless shelters. You're also at risk if you are a healthcare worker and treating patients with the disease. Infants are also at risk, including children, if they are exposed to an adult with the disease. Both micro and macro deficiency increases the risk of TB because of an impaired immune response. Children that are malnourished are twice as likely to contract TB. Tuberculosis itself is known to lead to malnourishment because it decreases the appetite and changes the metabolic process. Roughly 60 to 80% of children exposed to a sputum smear positive case became infected, compared to 30 to 40% of those exposed to a negative sputum smear. 2 years of age or younger became infected from someone in the household. Children 2 years and older are more likely to become infected from someone in the community. A systematic review comparing 13 studies examining the association between diabetes and TB found that diabetic patients had about a threefold increased risk of developing TB when compared to those without diabetes. 3 cohorts and 18 cases control studies concluded that the risk of active TB is greater among people who drink more than 40 grams of alcohol per day. The reasons for this increase include changes in the immune system, specifically the change in the signaling of molecules that are responsible for the cytokine production. HIV plus TB equals double trouble. HIV is the most powerful immunosuppressive risk factor for developing tuberculosis. HIV greatly increases the chances of reaction of latent infections of TB and increases the rapid TB progression. HIV exacerbates the severity of TB while TB accelerates the infection of HIV. That's why it referenced the double trouble. Addressing the social determinants of TB. How the WHO plans to eradicate TB by 2030. The goal is to eradicate it by 2030 by pursuing overarching poverty reductions, strategies in expanding social protection, reduce food insecurity, improve living and working conditions, improve environment and living conditions in prisons and other congregate settings, address the social, financial, and health situation of migrants, and promote healthy diets and lifestyles, including reduction of smoking and harmful use of alcohol and drugs. The PATH program, HIV, AIDS, and tuberculosis. Programs such as PATH, with over 1,200 employees, help communities in more than 20 countries that help to give people better access to effective HIV and AIDS and tuberculosis prevention, diagnosis, care, and treatment. By offering new screening tools, promote healthy behaviors like HIV testing and treatment, combat stigma and gender inequality and race, partnering with local programs to strengthen communities by developing innovative health intervention and treatment programs. 10 million people and 1 million children are living with TB worldwide. 1.5 million people die of TB each year, including 250,000 people living with HIV. TB is the leading cause of death among people living with HIV. Only 50% of childhood TB cases are reported, and only 27% of children less than 5 who are eligible for TB preventive therapy are able to start it. The references is CDC 2016, CDC 2019, disease symptoms and risk factors, the WHO 2020 tuberculosis retrieved 25 July 2020, and PATH 2020 about PATH, HIV, AIDS, and tuberculosis. Thank you very much.